reaction was very positive. Not only are they interested in the concept, they're interested in having this type of benefit added for them through their employer. Over 70% of all the different employee groups saying that adding this benefit would make them feel like their employer was really taking care of them as a person, cared about them and their families, would make them feel more financially stable. Lots of benefits just by including this package, even if people aren't extremely likely to use it.
This information is golden to the employer's ear. They want to hear things that matter to the employees because key talent is really difficult to keep. And so making sure that they're positioned to keep that talent is really critical.
Hello, my name is Kumar Dharmarajan. I am the Chief Medical Officer and co-founder of World Class Health. At World Class Health, our mission is to provide employers and their employees access to the highest quality healthcare at global centers of excellence. We identify the highest quality provider at the best prices through our global network to match employees to their preferred destinations. Wendy, Kerri, happy to have you today.
Thank you. Thank you, Dr. Kumar.
All right, we're really excited. We have two great guests. We have Dr. Wendy Smith, Senior Vice President at World Class Health. We also have Kerri Holiman, VP at YouGov. And the reason we're here today is to discuss the results of a YouGov survey, which was on World Class Health's model, which includes travel to receive care for elective procedures at global centers of excellence, with concierge support, the companion, and at low or no cost to the patient. We talked to two types of patients, or YouGov did, global travelers and blue-collar workers, to get their opinions and feedback on the World Class Health model. And before we get started on that, I thought, Kerri, if you can give a little bit of your introduction as well as an introduction to YouGov, I think it would be great for our audience.
Absolutely. My name is Kerri Holiman. I work here at YouGov. YouGov has been around for over 50 years. We have offices in over 50 countries, and we've been recognized by Pew Research as well as 538 as high-quality sources for information, sampling, and methodology. So we were able to conduct a survey for you folks today, reaching out to people on our panel and our partner panels to understand kind of interest in this type of service and what would be driving that.
Awesome. So, Kerri, maybe you can start by summarizing for us a little bit about the approach you took to the study. What was the questions you were trying to answer? Who did you reach out to? What were the subtypes of folks there? Because I think that context will be great as we talk about the result.
Sure. We conducted an online survey with global citizens, 504 of them, as well as value-focused workers, 553 of them, with a 12-minute online survey conducted between May 22nd and 28th of this year. We asked questions about their general health, their satisfaction with their current health insurance, and then presented them with the World Class Health concept and asked for their opinions there. Our global citizens audience group are aged 30 to 60. They're either an immigrant to the U.S. or a first-generation U.S. citizen with parents or other families still living in their original country of origin. Value-focused employees are age 45 to 65. They make $70,000 a year or less. They reside in states with some of the states of the highest medical debt, such as Alabama, Mississippi, and others. They work in industries such as construction, logistics, wholesale trade, maintenance, repair services. Our global citizens are more likely to be in the tech industries, accounting, finance, things of that nature.
Awesome. Thanks for those details. And for our audience's benefit, the reason we care about global citizens and folks who are more value-focused is that we believe, or the hypothesis was, that people with close ties to other countries who are recent immigrants, for example, to the United States, would be more likely to go home or to other countries to seek care. And we also hypothesized that people with lower incomes, again, insured through their employer, but lower income, would be more value-focused and would be interested in taking advantage of the lower costs as well as high quality that is available internationally. All right, Kerri, so let's get to the primary findings. So first, can you summarize what were participants' reaction to the World Class Health concept?
Absolutely. Reaction was very positive. Our concept outlined many key, wonderful, positive features for them to use, and they responded in the affirmative. Not only are they interested in the concept, they're interested in having this type of benefit added for them through their employer. And they also have high likelihood of using this type of service if they need one of the top 4 surgeries that we asked about. After looking at this concept, their impressions of their employers, if their employers were to add this type of benefit, were also very positive. So not only do they think it's an interesting concept, they're interested in having access to it, but they think that an employee that would provide them access to this type of service really would care about them, their family, and their financial stability.
That's really great. And for the benefit of the audience, I think, Kerri, you mentioned the 4 types of surgery. We asked the participants about their interest in orthopedic surgery. Those are musculoskeletal sort of joint hip replacement, knee replacement, shoulder surgery. We asked about cancer surgery, as well for obesity, bariatric surgery. Those are gastric sleeve, Roux-en-Y, those types of procedures the audience may have heard about, as well as cardiac surgery. So this is bypass surgery and other forms of cardiac surgery that typically happen. So Wendy, you are an employer. What would these results mean to you?
It's just reaffirming, what we've been studying in this space for a while is that the move to bundled payments is really impactful from a cost perspective and also the predictability aspect, because in any given market, there's a lot of variability. In New York City, that might be from 25,000 to 100,000. And so that variability without any correlation with quality is really what we're trying to help the employer understand and look at. And so, the results here say to the employer, this is something that is important to my population. And then it says to the employee that, yes, this is something that is not uncommon in terms of looking at doing this type of surgery outside of the country.
Thanks, Wendy. Kerri, what were the primary benefits that participants believe they would receive by receiving Care Going?
Everyone we talked to, whether they're a global citizen or they're value focused, or even if they're a very high earning global citizen, was most interested in the cost saving. Having no out of pocket fees or no copays was really the top benefit that almost half of all respondents said were of interest to them. So that cost saving is clear, by and large, the biggest benefit for them. Previous medical travel taken by global citizens have also been driven by cost. So these same participants are looking for ways to minimize the cost of healthcare procedures in the past, and they see that this service would be a way to do that. Making sure that everyone knows that not only is there the no copay, but there's also the bonus financial incentives that can help cover the other parts of medical costs or travel outside your home, which is a problem or more difficult, at least, for the value-focused folks, is a way to help people understand that this benefit covers a little bit more than just the medical, but can help to facilitate the process as well.
Wendy, again, putting on your employer hat, how would you respond to this data?
I would say that it's consistent, again, because the employer is looking to have a high quality experience for their employee. We're hearing that that's an important thing for them, and they want to make sure that their employee can afford what's happening. So we know that the coinsurance and deductibles have continued to rise with high deductible health plans, and oftentimes this has been a deterrent to having those surgeries. And so again, we feel like what we're hearing in the data results is really just reinforcing what we've known from employers, and we've been hearing from those employers for the last 5 years. But, this global aspect is also not something that people are saying no to. So that's reaffirming as well.
I agree. I think the results here dovetail well with our experience working with employers in North Carolina, where we found that cost was a major issue for their employees, and they were delaying care, and the ability to get care abroad, have some of those copays waived, deductibles waived, essentially having a $0 cost for going abroad to receive care, was really compelling to them. And it's really interesting, Kerri, as you presented your results, and we're going over top level findings here. There's a lot more detail that can be had. It wasn't just the value focused individuals who felt like cost was an issue and an opportunity here with travel to a global center of excellence. It was also folks who were global citizens, and including those global citizens who are higher income earners. Just thoughts, Kerri, on that, and Wendy after that.
I think everyone is aware that costs for medical procedures are not small. Even the higher earners in our sample, while it's lower, some of them are still carrying medical debt. Some of them have delayed health treatment in the past because of cost. So even though you're bringing in more money doesn't mean that you have a lot available to cover higher cost medical fares. So the ability for this service to offer that kind of support is going to be a valuable asset to anyone, regardless of the current financial situation. It's going to be seen as valuable among everyone. It's going to be extra valuable to the people who have limited means to begin with. But really, for the folks that don't normally travel, or don't have a lot of easy ability to be away from home for like more than 5 days, understanding how this service supports that kind of travel opportunity and supports the travel costs is going to be a really big player in helping people to take a lead.
I agree, Kerri. I think just, again, the high deductibles, 3,000 actually is fairly low these days. It can go 3, 5, 7, 10, even above that. And so for anyone, whether you're higher income or lower income, these are numbers that are important to you, and certainly makes it something feasible to look at is doing the abroad situation where you can go and have that completely waived and still for the employer save significant dollars. And again, it's about the quality as well.
I agree. And Kerri, some of your data additionally showed that many employees, you sort of alluded to this, feel positively about employers that provide benefits that can give them access to care at lower costs. Curious if you can give us a little sense of the data here in just terms of how employees feel about this benefit, how that makes them feel about the employer. And Wendy, interested in your thoughts on that as well.
Yeah, we saw lots of people, over 70%, I believe, of all the different employee groups, saying that adding this benefit would make them feel like their employer was really taking care of them as a person, cared about them and their families, would make them feel more financially stable. We saw also fairly high levels of agreement that this would make employees continue to work in their current job, and would also allow them to recommend working for this company to others as well. So lots of benefits just by including this package, even if people aren't extremely likely to use it.
Yeah, this information is golden to the employer's ear. They want to hear things that matter to the employees because talent retention is very, very high. The unemployment rate is at one of the all-time lows. Key talent is really difficult to keep. And so making sure that they're positioned to keep that talent is really critical.
I agree. And just underscore, Wendy, what you were saying, Kerri, that the number of people indicated that it was not only just of interest to them, but it would be something that would make them want to stay with their company. Kerri, one of the things that I appreciated the survey also did was highlight some concerns employees would have with the model. Could you highlight some of those? And I think it's worth discussing those as well.
Sure. The biggest worry about using a service like this is what happens if things go wrong. So I expect to fly to my location, get my surgery, heal up, head home. But what if something happens and we kind of blown off course? Understanding kind of what happens next, what world-class health role is in ensuring that everything goes smoothly and you get returned home will really help to allow people to have more confidence in the process. And we saw this across all types of different employees. Global citizens are viewing the cost as less of a barrier here than we see among the value focus who aren't 100% sure that all of the travel costs would be covered. and may have additional costs, or they may think that there are hidden costs to travel. For example, if they have child care or other family limitations that disallow them from traveling for too far for too long. But global citizens also want to make sure that their support system is available. So not only what happens if things go wrong, but are the people that normally offer and provide me with that support going to be available to me, or am I going to be completely by myself? One other issue that we saw is in terms of just general perceptions of the types of quality care available outside of the U.S. Many people feel very strongly about the quality that they would get in Europe and Asia. Latin America is a region where people are less enthusiastic about the type of quality that they would get there. And that is particularly high among people who haven't traveled outside of the U.S. You don't have a passport. So communication about the quality, really providing those testimonials, those reviews of the different professionals in the facilities will really help to really calm everyone's nerves, take out some of the question marks about what's going to happen or what it's going to be like, to help people, really be able to feel like they understand what's going to happen and it's going to have a good outcome.
Kerri, I think those are all very important points. I think a few things we could do at World Class Health to address them, and I think there's very important. So first is to really get at the issue of trust. People need to trust their doctor more generally. They also need to trust their doctor in a case where they're traveling for medical care. That makes a ton of sense. And you already highlighted some of the things we could do on trust. Make sure there are patient testimonials, make sure patients have the ability to talk to doctors that may be delivered care to them overseas, and also understanding that the place they're going to is truly a high-quality setting, giving them a sense that the doctors are appropriately credentialed, they've done a ton of these procedures, that they have good outcomes for those procedures. I think there's actually an opportunity here because even in the United States, patients have relatively little insight into the quality of their doctors. They might understand how good they are interrelating, the sort of interpersonal skills, which are important. But in the U.S., and I'm a physician as well, it's hard for me to get access to understand which doctor is particularly high quality for a given procedure. That often involves, talking to other doctors and those people to know, hey, who would you send your family to for a given procedure? And I think there's an opportunity here to create that trust and transparency here and do that not just for the international setting, but level that up in the United States as well. I think that's something patients are really asking for.
Choice and transparency of locations and surgeons came right under the financial benefits of the program. So ensuring that there's an opportunity to review all of that information will be high up on employees' list of things to really rely on when they got to make this decision.
I agree. And there's some companies right now that are really leaning into destination medicine. We spoke in the past in webinars with human resources leaders at HSM Solutions, based out of North Carolina. And they really try and increase trust in part by having the employees have access to the physicians that talk to them even before they may be considering surgery, making sure that employees talk to each other, and making sure that those employees who previously traveled had an opportunity to share their experiences more generally to the employee base. And they have found that with those and other trust-building mechanisms in place, they're actually able to get uptake to 20 to 30% of employees who are considering procedures that are covered through their global medical travel program. Wendy, any thoughts you have on this?
Yeah, I would say that some of the other key factors is that the facilities that we're using, the hospitals that we're using, are internationally Joint Commission accredited facilities, and that we've done the vetting of both the hospital facility and the surgeons. And so to your point earlier about looking at the quality outcomes, that is really important to the employer. It's really important to the employee. Other aspects of, that personal trust from an employee perspective are these testimonials. They're friends and their neighbors that have gone through this process. And that's always meaningful, whether you're getting regular care in the U.S. That's how we generally source our doctors today. And so using these quality metrics, Joint Commission accreditation, the personal vetting that has been done by World Class Health in the negotiation process and making certain that the navigation, which is going to be a true differentiator, and how that employee is managed through the process, much more so than in today's world, which we experience, the surgical episode. So all these things absolutely lead to the trust factor.
So I appreciate your time, Wendy, today. Kerri, do you have any closing thoughts on the survey and what that might mean for this world-class health model of care? And then, Wendy, interested in your thoughts as well afterwards.
In terms of voice of customer, I think what you have is a very interesting offer that people would like to get to kick the wheels on a little bit more. It seems very great. And because so much of it leans on the financial incentives, there might be a little bit of hesitancy of, is this real? It seems too good to be true. So really kind of building out how the process will work with people as you offer it out. I think will be really helpful for employees to accept it as a benefit that would work for them. It could solve some of their issues. And then I think employers will also see this data and see that offering the type of support to their employees is really going to help them with retention and essentially just like positive impressions toward the employer. Benefits is generally one area where we can always just be a little crabby. There's always something better that you could offer me. Adding this seems like a good way to kind of bump that positivity up in terms of perceptions of employers.
Yeah, I would just say looking at these survey results and using that information and the positive feedback, we can start to have these really important conversations with employers and employees to make them aware of what we're offering and how that is done. And that's really exciting proposition for us.
All right. Well, thank you very much. And just summarizing here, YouGov survey, it validates employees' interest in the world-class health model. Some top-line results were that 66% of global citizens and 63% of value-focused employees were extremely interested or very interested in the model. The cost-saving $0 copay was viewed by the primary or secondary program benefit by 57% of global citizens and 69% of value-focused employees. And the majority of employees surveyed would be more likely to stay in their position because of the benefit. And we're really excited about these results. Hope folks listening to this webinar as well. And Kerri, Wendy, thank you for your time today.
Thank you, Chuck.
Cool.